Hello, everyone. Delighted to have you here. Thank you so much for joining. And we're very, very honored to have Dr. Debbie Hamilton with us this evening. She's a wonderful doctor who I'll introduce in a moment from the US, who came over and spoke at the Integrative and Personalized Medicine Congress. And she gave a talk at the Mental Health Day there, which was the second day of the very, very big Congress held at Westminster. And we asked her whether she would be kind enough to give us a replay of that, as it were, though it is going to be slightly different. She has updated it of the same talk that she gave there. So it's called Combating the Escalating Mental Health Crisis, Harming Our Adolescents. And Debbie herself is an MD with many, many other titles to her name. She's a pediatrician with experience in primary care, integrative medicine, research, speaking, and writing. She's board certified in pediatrics, physician nutrition, integrated and holistic medicine, as well as functional medicine, where she has full training. And she has a Master of Sciences degree in public health. She founded Holistic Pediatric Consulting in Colorado in 2005, and her practice focuses on treating children primarily with chronic diseases such as autism and ADHD, and preconception counseling. She's also written a book called Preventing Autism and ADHD, Controlling Risk Factors Before, During, and After Pregnancy. And this book led to her collaboration in the writing of the Healthy Child Guide through the Neurological Health Foundation, where she's on the executive and scientific board. So, Debbie, I think when we send out the recording of this, we'll put links to both of those books in the recording. So thank you very, very much. We're delighted to have you here, Dr. Debbie, and we will, of course, have ample time at the end to ask questions, so please pop them into the chat or the Q&A. And over to you. Thank you very, very much, Dr. Debbie.
Thank you. I'm really happy to be here. And I said I really enjoyed being at the IPM, so enjoying this topic. It's a really important topic to me, so thank you for all attending today. So the issue. So I have the mental illness rates in the UK and the US. So in 2024, 1 in 4 adults experience a mental health problem. And since I focus on adolescents, I also want to say I think of kind of continuing into the early 20s. And so in that way, the adolescent mental health crisis is really what I think of into the 20s, 24. And if you look at the rates here, that this age group is disproportionately affected. Looking at the US rates, again, the highest rates among young adults aging 18 to 25. And COVID, as I said, did us no favors, and these rates have really escalated since then. So functional medicine likes to treat the cause. So in traditional medicine, we have diagnosis of depression or anxiety or OCD, behavioral disorders, but we want to know why, and the symptoms of underlying diseases. So why do depression? Because you can have depression in a lot of different types, and that's more of a symptom. Why is somebody having problems with memory or their concentration or their mood? And then why is this, as I said, disproportionately affecting adolescents? And there's multiple reasons. So like in medicine, if somebody says, I'm depressed, you have to find out what other issues they have, because that's going to clue you in to how to target basically the underlying cause. So things like fatigue or poor endurance, what kind of pain, what about headaches, rashes, neurologic symptoms, sometimes really, strange symptoms that you really, most people wouldn't correlate. So that's really important, plus mental health issues and family history. So we know that the social environmental causes of mood, that this contributes. So we're going to focus on the physical, knowing that this is, as I said, we can target the physical, but then a lot of the other issues, especially for our young people with a, very expensive world, finances, kind of making your way in the world, and really rapidly unchanging, as we all know. So the underlying physical causes of mood issues, we're going to kind of go through each of these. And these are the ones to think about: nutrition, You always have to talk about nutrition and the gut in all functional medicine as kind of the basis, the whole gut-brain microbiome. We need to think of how the stress, the HPA axis, mitochondria, hormones, and infections and immune system. So underlying biological causes, diagnosis, and treatment. So nutritional. So what are people eating and what are they not eating? Sometimes what they're eating, there's so much that is actually harming them that we have to think about. And then have to think some nutritional clues, mental health symptoms like skin issues, like nail changes, rough skin. Those can be clues to nutritional deficiencies, digestive issues, energy issues. So kind of the basic nutritional lab test that I look at. Vitamins that work well to test in the blood, like vitamin B12, zinc. Minerals are good to look in the red blood cell, not just in the serum, to get a better idea of stores, and a full iron panel. Metabolic panel. Some people are actually too low, especially in my autism population, and then malabsorption. So it's not just a high cholesterol, low cholesterol can be an issue. Hair test, looking at minerals, organic acid test, lots of different nutrients on it. A great way to look at some dysbiosis markers, food allergies, and something called cryptopyrroles, which kind of tells people if they need additional magnesium, zinc, and B6, all critical in terms of some of our neurotransmitters. So magnesium and zinc are two of the most common mineral deficiencies that we have. Think of magnesium as a calming mineral, so it's great support of mental health. It helps regulate glutamate and GABA. It helps regulate cortisol, the HPA axis, supports neurotransmitters like serotonin and dopamine. It does something called increases BDNF, which is our neuroplasticity, which I'll talk about too, because that's an important piece in terms of treatment. So nutrimetics have magnesium malate. So every mineral has to be bound to basically amino acid in order for absorption. So what is bound to makes a big difference in terms of the function. So magnesium malate, if you think about mitochondria and kind of ATP energy production, which can play a big role in terms of mood, malic acid helps. So I think of magnesium malate as something that's going to help your energy, help the ATP. So help things like, poor endurance and energy and things that can be impacting mitochondria. So really kind of you get the magnesium calming and the malate support of the mitochondria. So zinc, I learned a long time ago in kind of the autism world, no zinc, no think, because zinc's important for many, many metabolic processes. It really plays a role in just mood and behavior and energy. And some people with kind of mood issues will have digestive issues and might not be hungry. And low zinc causes a decreased appetite. Um, and the people who I think about, those kids who have the 0 to 60 and get really what I call rage behavior, that can be a sign of zinc deficiency. So really kind of important to look and address these two. Nutrimetics has a zinc bisglycinate. So again, zinc bound to glycine. So glycine is an amino acid. It's actually also a calming neurotransmitter. It's often used in sleep formulas because it helps people go to sleep. So the zinc glycinate, it has a zinc, which is critical, and then has the glycine form, which, as I said, is a really calming form and also really well absorbed. So just, you have to think about with minerals, what kind of form you're getting. So omega-3 fatty acids, we know really anti-inflammatory, but they have a mood stabilizing, and there's research on omega-3s in terms of mood stabilization. So again, we're talking some of the things that I think are really foundation for mental health. So vitamin D plays a role in depression. And how common is vitamin D deficiency, especially if you don't live in a sunny area or don't get a lot of sun, especially in winter. Also anti-inflammatory, and inflammation actually plays a role in a lot of mental health issues also. So B vitamins, just the general B vitamins play a role. They're a cofactor in many different neurotransmitters, a lot of different metabolic processes, the mitochondrial energy. So again, and think of then genetic issues like methylation. One of the B B's I like a lot is the B6, the P5P. It's actually a cofactor in serotonin and melatonin synthesis. So it impacts a lot of different amino acids. So as I said, having the right forms, the active forms of Bs, we have Nutrimetics has a methyl complete B complex. So it supports methylation, which is actually critical for some of the other, for energy, but also kind of it plays a role into kind of growth, development, detox, and neurotransmitters. Um, this has a lot of the active forms. It has the P5P active form, methylfolate, methylcobalamin, creatine, I think of mitochondrial health, TMG in terms of methylation. So really helpful. The one thing about the Bs, especially B12, is to take them in the morning, just because B12 can give energy. And here, as I said, some of the information more about omega-3s. I wonder if actually I'm going forward. So in terms of omega-3s, Antarctic krill oil is like basically three supplements in one. You get the omega-3s. You also get choline, which is a critical B vitamin, especially in terms of, if you think about the phospholipids, phosphatidylcholine in terms of membrane health, methylation. So it has that. It also has astaxanthin, which is really important anti-inflammatory. So kind of multiple different helpful uses. I said vitamin D deficiency. Vitamin D deficiency is actually associated with increase of suicidal ideation. Actually, low cholesterol is also one of them. So it's interesting that even severity of mental health and depression issues. But if you look at vitamin D deficiency, anxiety, inattention, poor concentration, some of these look like ADHD and, as I said, depression, anxiety, and even panic. Nutrimetics says of a vitamin D3K2, vitamin D3, I'm still thinking 5,000 IUs, so a really good dose. You always need to have vitamin K with it also. So microbiome, we know the gut-brain microbiome is really kind of another important. I always address nutrition, always address the gut. These are kind of always some of the foundation. The gut has, 70% of our immune system. It has more neurotransmitters than our brain. So really important to address it. And now they have learned research on targeted strains, what they call psychobiotics. So again, kind of some of my foundation. So if I had a general nutritional kind of background, and I'll often, people come in and they'll leave. I'm like, okay, these are some of the basic things that I want them to take, and then kind of start looking for some of the other underlying causes. So multivitamin, zinc, magnesium, vitamin D, and omega-3 fatty acids, probiotic, B6, and a B complex. So adrenal issues. Most people, when I see kids with depression, it seems most often there's an anxiety component. So most people don't come in, oh, I'm really depressed or I'm really anxious. It's kind of both together. And you notice they often come in fight or flight. I said, we have a stressful world. These kids are feeling this stress. And so they're in fight or flight. They've elevated cortisol. And so they're always in kind of that hypervigilant state. In order to kind of get them to feel better, you have to get them out of that. So you really need to get them to kind of more of a homeostatic, because just like in some ways it's like resilience. It kind of increase their resilience, increase their ability to tolerate stress. So if you look at the physiologic impact of chronic stress and anxiety in the body, it decreases BDNF neuroplasticity. That's the ability of the brain to heal and grow. Increases cortisol, increases inflammation levels, and then you deplete the calming neurotransmitters like serotonin and GABA. You get more metabolic issues, right? Increase insulin, that's going to increase. It actually hurts the mitochondria too because of inflammation, oxidative stress. So when I think about adrenal stress, the B vitamins are really critical. The vitamin C is really, really critical. There's a lot of different what I call adaptogens, right? And adaptogens kind of, I think, of bring to baseline. Ashwagandha is another one that lowers cortisol. So, and also is research on decreasing depression, anxiety. We have an adrenal formula that's astragalus, schisandra, ginseng, and rhodiola. And that one I think of when people are so depleted that they really need that extra resilience. That is a great kind of supportive formula. Ashwagandha is more for people who are so heightened that they need that cortisol, right? And sometimes you kind of need balance because people are going like this. Phosphatidylserine, another phospholipid, lowers cortisol, helps the cell membrane. And then I think of calming herbs like lavender, magnolia, skullcap, valerian, lemon balm, and chamomile. And chamomile I'll talk a little bit more about in the end, but that has kind of dual functions because of the support of the digestive system. Essential oils can have immediate effects as something that they have with them that can help immediately. This is our adrenal formula that I mentioned, the astragalus, rhodiola, and a lot of these are, as I said, have been known adaptogens. It's interesting because they're from different kind of herbal traditions, but they've been all been well used in, for many centuries, actually. So I said the microbiome, and this just kind of shows the connection and research on how the gut microbiota and its metabolites can impact depression. So it's not only kind of the gut-brain neurotransmitters, but even it seems like certain kind of strains of our microbiome bacteria are more associated with help better moods, and some are actually associated with more depression. So it's kind of I think where this is again still an evolving field. The metabolic, thinking about mitochondrial dysfunction, thyroid dysfunction. So mitochondria, your brain uses a lot of energy kind of per size. And if you don't have energy, it's hard to think, it's hard to concentrate, memory, but mitochondrial dysfunction can really very much impact mood. You also get other symptoms like poor endurance, poor exercise recovery, low muscle tone, slow processing, even constipation. So in terms of testing, organic acid testing, some indirect markers, the blood, but I don't always see blood seems like you don't, even if they have mitochondrial dysfunction, you don't always see it in the blood. There's genetics from the mitoswab, and actually AONM has a really good mitochondrial direct function testing that I was learning about in London. And I would ask them more about that because that really seems, you know, honestly state of the art and a lot more information, a lot more specific information in terms of diagnosing this. And the other thing about mitochondrial dysfunction, and we'll talk about PANS, and infections, is you can see multiple of these things. Like you often see mitochondrial dysfunction with chronic Lyme or mold or a lot of other chronic conditions or with PANS. So just because you have this, you have to look, why do you have this in addition, right? It kind of goes together. And this talks research about specifically about mood and mitochondrial dysfunction. So one of the other things that we have is many people, kids end up on medicines, and a lot of our medications actually cause mitochondrial dysfunctions. So here we have, these kids on antidepressants, anti-anxieties, different medicines, and these actually can cause further mitochondrial dysfunction. A lot of our people know about it for cholesterol medicines, the antibiotics, even our Tylenol, our ibuprofen, or anti-inflammatory. A lot of our different medicines can cause this, right? So you can get in a cycle that you kind of have to consider. So thyroid dysfunction, if you have low thyroid, can present as depression, right? It's kind of slowing. Hyperthyroid can present as actually ADHD and anxiety. And then additional thyroid symptoms, you think about fatigue, constipation, dry skin, and then kind of slow cognition. And then it's really important when you're looking at thyroid dysfunction to, some doctors will look at just a TSH and free T4, but you really need to have a full panel, and often autoantibodies too. So infections, inflammation, immune system dysfunction. So this is PANS, and PANS is pediatric, basically autoimmune neuropsychiatric symptoms. PANDAS is from strep, PANS is from other infections. It causes a basal ganglia autoimmune encephalitis and very severe, abrupt mental health, kind of rage, anger, developmental delays, pretty severe. I will be speaking on this next week, and this has really exploded in terms of what we're seeing, what we're recognizing, especially since COVID. I think COVID is kind of pushing our immune system. So really important to kind of consider in the kind of differential of kids who, especially if they have severe kind of behavior and really abrupt. So strep is one of the classic ones, but I've seen staph, candida, mycoplasma. You really need to think about some of the Lyme disease and the co-infection, specifically Bartonella. Bartonella causes really severe neurologic issues. But viruses, toxins, mold, it seems like a lot of different things. And I said COVID probably is a trigger. Usually I see COVID and then it kind of triggers like a reactivation of like EBV and kind of helps trigger the whole system. So this talks about, it seems like inflammation, you think of microglial inflammation, can actually be part of the neurobiology of depression. So think about your chronic Lyme patients or my chronic PANS patients. They don't sleep. You know, that sleep is a huge issue, and we obviously know that it's really important to sleep in order to get these people better. So toxins, we know chronic toxicity, very non-specific. There are a lot of environmental toxin panels, hair tests, challenges tests, mold tests, glyphosate. Again, you know, there's nothing specific about toxicity, but we're all exposed. And it's definitely something you think about. A lot of these toxins are neurologic toxins. So mycotoxins, we're learning more and more about mycotoxins, you know, the severe toxin part of the mold. See a lot of mood, depression, anxiety issues, a lot of ADHD. You can see a lot of developmental issues, learning about how it affects actual development. You see a lot of Lyme patients. You also have mycotoxin exposure. So, and I've seen, I said, PANS patients who mycotoxins are a significant contributor. So as a pediatrician and talking to pediatrics, just the effect of mycotoxins, we're learning more and more, but even in pregnancy, exposure can cause neural tube issues, birth defects, but even long-term developmental and growth issues in these kids. So in terms of detoxification, there's definitely formulas to remove toxins from the body. Algus is a seaweed. And we have cilantro. These are Nutrimetics products. That's chlorella and cilantro, which are very well known specifically for heavy metals. And the algus, the seaweed. One the other thing that helps for mycotoxins, helps for toxins, and also helps if you're treating dysbiosis and you're having die-off from bacteria or candida, is a binder. And different mycotoxins are actually bound by different different binders. So having a combination is usually the most effective. And our binder plus has charcoal, zeolite, inulin, and aloe, supporting GI health because one of the side effects is constipation, bentonite clay, fulvic minerals, and chitosan. And that chitosan is from mushrooms. Not see like basically some, the shells of um, seafood allergy, people with seafood allergies. So we also have something called Berber panella, which I consider, if you've ever used what I call drainage remedies, things that help kind of the liver and the kidneys and the lymph process. Berber panella is a combination of two herbs, and it's our primary detoxification formula. Anybody treating with PANS who might have a die-off or Lyme or dysbiosis can really be helpful. And as I said, we use it primarily for herpes prevention. You can even use it acutely for every 10 minutes. So this can be a big, big support. The panella part is actually a really good nervous system detox, even the G lymphatics. And if we're talking about neurologic issues and depression, anxiety, and brain cognition, like cognitive issues, then this can play a significant kind of support. So genetics, we know that genetics plays a big role in depression. There's a lot of family history. Always need to ask about family history. There are certain genetic SNPs that really can basically give you some information about issues. The poor methylation, MTHFR, but it's not just MTHFR, poor detoxification, the glutathione SNPs, problem with organic phosphates. We know these are kind of detox issues. You can have glutamate issues. I see this in a lot of kind of my kids, especially with autism. And then you know that GABA, you really need to support GABA, low vitamin D, some of the neurotransmitters, the COMT, neuroplasticity, BDNF. There's some SNPs in the BDNF gene that increase your rate of some depression by about 30%. There's microbiome genes and then emotional regulation genes. So I want to mention these two because I do genomics panels, and I do some that will look at also, some of the different SNPs that are targeted for mental health, and also even kind of how you process different things, including medicines, because do have a lot of patients who come to me in medicines. So I tell these two because these are some of the kids I've seen with the most severe symptoms have had these two genes. And one is called the ANC3, which is a sodium channel gene, and the CACNA1C is a calcium channel. And these are the ones that I associate and see the most with emotional, I want to say instability or dysregulation. These are the people who get the diagnosis. And both of these SNPs are associated with higher, in research, higher rates of bipolar, schizophrenia, autism, intellectual disability. You can also see migraines, cardiac issues. So this is definitely something that you need to target with mood stabilizers. So if you have the calcium channel one, magnesium is actually one of the most helpful. And then omega-3 fatty acids for both, as I said, are mood stabilizing, and that might be part of the mood stabilizing. And then there's lithium, and there is prescription lithium, but there's also nutritional lithium, and that can make a big difference. And usually if I find patients with one of these, I'm using all three of those. So BDNF is brain-derived neurotrophic factor. And this is the growth factor that's associated with neuroplasticity. And low BDNFs are associated a lot with depression. There's certain things like traumatic brain injuries that lower BDNF. And we know traumatic brain injuries is a risk factor for depression, anxiety. But supporting the ability of the brain to heal, it helps with kind of the cortisol regulation, but it really helps with mood and kind of brain function. So there's some that are there's several are kind of anti-inflammatory: lion's mane mushroom, ashwagandha, Bicol skullcap. And so Bicol skullcap is immune modulator, it's anti-inflammatory, it actually treats infections, but I really like it for its BDNF and neurologic support. And I said this is a Nutrimetics product. Both skullcaps, Aveas, turmeric, a lot of mood issues, and I'm going to kind of talk a little bit more about when I get into the herbs. So trauma, as I said, traumatic brain injury associated a lot with depression, anxiety, and trauma too. People who have not just traumatic brain injury, but history of trauma too. And that needs to be, identified and addressed too. So we do have some tools, and some of these are newer in terms of actually diagnosing. And there's something called the QEEG, and they found, and this is again evolving sciences, is there's certain patterns, like this is an ADHD pattern, and this is a depression pattern. And so sometimes it's like, oh, it looks like anxiety, but wait, it's more of an ADHD pattern, or migraine or anxiety, and that really helps target some of your treatment. There's also SPECT scans. Dr. Amen is very well known, and even certain areas in the brain more active or less active. And then that actually helps you target your treatment also. So we do have some kind of scanning and some other ways in addition to some of the labs and organic acid tests. And then again, trauma therapy, I do recommend, psychological therapy, brain therapy, CBT. There's trauma therapy, EMDR, brain spotting. So I do think that this is a comprehensive approach, right? There are usually multiple factors. So kind of a summary of lab tests. And again, you're not going to do all tests in all patients. I do think the nutritional are really basic. A thyroid panel, especially if it's never been done, is great. Organic acid test for me is one of the, as I said, very important because it targets so many different areas. Adrenal stress panel, I don't do that as much just because most of people, it's obvious that they're in that kind of fight or flight. Mitochondrial testing we talked about, then looking at, food allergies, digestive functions, and then depending on the history, um, there are specific tests just for like the PANS. There's an autoimmune neuronal panel that can be very helpful, actually diagnosing, looking at do they have specific neuronal antibodies. So then symptom relief, symptom treatment. So turmeric is interesting because, and we have the Vea, which I'll talk about, and curcumin, but people think about it as we know it's anti-inflammatory, but what people realize is there's actually a lot of research on depression. And again, having the immune dysregulation as part of the depression kind of pathology, and actually targeting that makes a big difference. But there's a lot of research on that. And curcumin does and turmeric do address some of the kind of neurotransmitters. They decrease, neuronal excitotoxicity. Obviously they help the gut. They help improve insulin sensitivity. So it's kind of a multi-spectrum, but I said very, very safe and very effective. So we have something called Avea, which is the turmeric root, right? You have the turmeric, the full root, and again, anti-inflammatory, antioxidant, but mood and anxiety support. And so this is great for kind of teens and really for everybody, but you can put it in your water bottle. And if you have an acute kind of anxiety, you can actually dose it. And there's a pediatrician who I learned from this, Nancy O'Hara. Well, she will actually dose it hourly, kind of acutely, or take like two full dropperfuls into a bottle. But you can also do it with kids, and you put it in their water bottle, and then they can kind of drink it throughout the day. Um, so as I said, really kind of an easy because you're doing the inflammation and you're supporting the brain. And again, really kind of easy to get in. So Babuna, which is the Nutrimetics chamomile, is called Babuna. And these are just specific. There's a lot of research on chamomile. One of the very safe herbs. I said I feel very comfortable, especially in even young kids using it. So research about it actually binds to the GABA receptor. If you think about anti-anxiety medicines, they bind to the GABA receptor, so same mechanism. It actually calms the brain, so you have decreased seizure activity, neuroprotective, again, that neuroplasticity has like anti-anxiety effects. So really can be very helpful and very safe. And I can put it kind of with, the Vea and the chamomile. I like chamomile also. So this is a Babuna. I like chamomile also because people use it. It's very supportive for the digestive system. Many people, especially if you're anxious, your stomach hurts or you're depressed and you don't eat, you'll have a lot of digestive issues. So it's kind of like, it's calming, help with anxiety, anti-inflammatory, helpful for bed. Because sleep is another issue. So got a lot of different functions. And again, I kind of combine things. So valerian, our valerian is called Amatia, is really people know it well for sleep. It has a lot of good research. It helps people fall asleep. And sometimes people have problems falling asleep, and some people have problems staying asleep. But this helps kind of deep sleep, quality of sleep. It also binds GABA, and it's good because it actually works partly as an adaptogen. So it's really helpful for managing chronic stress, working on the HPA axis. So if you kind of use kind of Avea, I don't think of Avea as much for sleep, as more kind of anti-inflammatory and anxiety. And then you got chamomile, and chamomile and valerian are kind of calming, anti-anxiety, and then valerian kind of promotes the sleep, getting that sleep plus the cortisol. So again, really safe herbs and can be used, kind of twice a day regular dosing, but also can be used, you can actually increase the doses if you really need kind of that extra support. And it's good sometimes for adolescents or somebody, the young adults to have something too that they feel like, oh, I can take this right away and that's going to help me right away, right? Because you want things that help kind of long-term heal, but you also want to have some tools that can work acutely. So 5-HTP we know is amino acid, precursor of serotonin, can also help with sleep, depression, anxiety. There are some people who you have to be a little more cautious with, especially if they're on a little other medicines in terms of serotonin. L-theanine it's basically a component of green tea. It's amino acid. I use this a lot for attention issues, but also anxiety because you can feel it within a short time period. Again, having several things like tools that can help acutely, kind of prove that supports GABA also and serotonin. There are some people who, and I've seen this primarily in children with autism, as opposed to, especially in younger kids, as opposed to older kids, will have like an opposite reaction. So St. John's wort has been used a lot for depression, has great clinical research on it. You do need to dose it about 900 milligrams a day. Um, it's basically kind of seen equivalent to SSRIs. So as I said, and again, sometimes I think, okay, we'll use St. John's wort and then we'll have, kind of some acute anti-anxiety calming and then things that help sleep, while we're making sure the nutritional and the gut and the mitochondria and infections. As I said, this is definitely a very comprehensive treatment. But these kids are sick and this makes a big difference. So saffron is another herb that there's actually, they're looking at, again, similar to St. John's wort in terms of being an equivalent for SSRIs for depression. So, and I said, I offer hope for the future. Definitely a big issue, adolescent mental health. And again, I consider adolescents into young 20s. I do have kids in their 20s, so maybe I'm biased on that. But I see a lot of patients in their 20s and 30s, and a lot of mental health issues, more severe. And so really offering hope, being able to really look at it from a functional medicine approach, and being able to, target it because people really can get better. And so I think that's, what I'd like to talk about today. I'm going to open it for questions, and I do appreciate everybody being here. So I will stop my share at this point.
Thanks so much. Very, very informative. Lots of detail that you got through in, swiftly, but
Simply.
very comprehensively. So thank you so, so much.
Oh, you're very welcome.
We do have a few questions, and some came in earlier as well. Um, are there any red flags that indicate a need for urgent psychiatric referral, even when using an integrative approach?
I think the suicidal ideation, and getting kind of I mean, that seems really logical.
Mhm.
Um, as I said, when you see the patient and also the parents, you'll also get a really good idea about how severe, how long of this, they're doing any kind of behaviors, withdrawals. This is you really do need to ask about that. I will say with the PANS kids, I've had kids who literally in psychosis and are hallucinating in the emergency room. And so that's it. If you are at all worried, you send the emergency room, although I will say it's not always most helpful, but you still want to keep them safe.
Right, thank you. And someone here is asking about the addictive nature of those medications. Is it more difficult working integratively with children who have been put on medications, whether Ritalin or Prozac or whatever? It does restrict what one can prescribe, doesn't it?
To an extent, like if you're thinking about like SSRIs, St. John's wort, 5-HTP, you have to be more cautious of. Sometimes people come because they want to wean off these medications, and that, especially the SSRIs, that is a really, really long process because people can rebound and get very almost suicidal and severe. So I always, if somebody comes in on medicine, I'm looking at everything, treating everything before I'd ever even think about weaning them off. Does that make sense? Because you really, and then even when they're doing better, your body adjusts to the serotonin. You really need to wean them off very, very slowly.
Right,
Um,
thank you, thank you. And I might have misunderstood that comment that's been put in the chat because the question was, are these medications addictive? And I think
the
perhaps what was
herbs,
meant was whether the herbs were. And
no,
Dr. Piquito has written, no, they are not addictive, but one needs to
no, they're not addictive.
there, doesn't one, between the herbs or nutraceuticals, of course, and the pharmaceuticals. Are
Right, I
any of
consider.
go ahead, sorry.
I guess this is a question, are the herbs addictive? And I don't think of any of those as
No,
addictive.
no.
No.
That's great. Thank you. Another question came in. Are there any herbs that can help a teenager, she's 20 here, with incessant hunger? It's an interesting
Incessant
one, isn't
hunger?
it? Yeah,
Yeah. I mean, is that just a kind of an anxiety? I'm not that sure that's a weight or kind of like um, kind of an addictive behavior or kind of a coping behavior,
you'd want to
if that
check,
makes
wouldn't you?
sense.
You'd want to go into the history and ask the parents as well, perhaps, if you can. They're over sort of, is it 16 or 18 in the States where you must sort of engage with the child and can't bring in the parents
18.
without permission?
Yes,
18.
18 is the age, United States. Um, but that also kind of a coping mechanism. It's like you treat the underlying cause of the eating, and then you kind of work even psychologically on kind of the coping mechanisms. But if you get the anxiety down, and they're feeling calmer, my guess is some of the behavior is going to be better anyway.
Yes, definitely. Sorry, another question that came in earlier that linked to what we were just discussing previously. How effective are conventional treatments like antidepressants compared to integrative approaches? You've
Approaches.
described that they can
Um,
be together safely with the right kinds of interaction checks, but do you find them effective or does it very much depend on the case?
It depends on the cause. I mean,
Mhm.
I've had kids who I always think of. I had two kids, really bad behavior, anger, rage, anxiety,
Mhm.
came in 8 and 10 years old. They came in, mom had them on a vegan diet. And this
Mhm.
is the most, and once we were like, their cholesterols were like 90, B12, iron, zinc, all of the things were really depleted, no omega-3s. And once
Uh-huh.
we supplemented them and very gently convinced mom to give them eggs and some other, these kids were fine. So it can be as kind of easy as that. A lot of kids do with even nutritional support and kind of targeted support or treatment get a lot better and a lot more stable. I mean, there's definitely a lot of kids you can get through without any medications. And
Yes, no,
then, yeah. And then,
sorry.
when I kind of showed the emotional regulation, those kids sometimes, you do both, but they need less medicine and they overall still do better. Does that answer the question in that way?
Yes, definitely. Though, of course, it is difficult if the child or the parents are resistant to changing the diet, particularly if they've been brought up vegan. That can be hard, can't it?
Yes, these are young kids, and she thought she was doing a good job. But when I showed her this, and then she kind of, once they did better, she was like, okay, she thought she was doing it. She's doing it for her health. I'm like,
Mm.
this is a growing child versus, a grown adult. And it's a very different what they need. But I also don't believe, but anyway, but it can be as simple as that. I've had people with severe anxiety. I had one kid with ADHD anxiety. Once they diagnosed hyperthyroid, they did great and it wasn't an issue anymore. So it can be that simple. Most people, if you have PANS and then you have GI issues and nutrition issues, and you have to target the immune system and the infection, and sometimes, talk about mast cells. I mean, it can be multifactorial, but those kids can all of a sudden they're back at school and they're sleeping. You really can make a significant difference in a lot of these kids' lives. I think you're on mute. I think I'm missing this question. Yeah, you are on mute. Gillian, you're on mute.
Oh, I'm so sorry. I had to cough and I put
Okay.
myself on mute. This
Yeah.
question about Pan's pandas from Afifa is a very good one. What are the first signs that we should be alerted to in Pan's pandas? But I think you'll be talking about that on the 5th of August, won't you? So maybe we
I
should
will.
reserve that one until then because it's quite extensive, isn't it? The
Yes,
answer.
it is. And it
Yes,
can
so
be
Afifa.
different too.
I'm sorry.
Oh, it can be different too. So it can be, different kids can present differently and then their backgrounds and sometimes even go back, it's like, oh, they might have had an early flare there. So yeah, that is a more complicated. We can go through all of
Yes.
that.
So if Afifa, if you don't mind coming back again on Tuesday, the 5th of August at 6 p.m. We'll be specifically covering, together with Dr. Hamilton, PANS PANDAS clinical strategies for immune and neuroinflammatory support. So that will be absolutely fascinating as well. Um, Going back to a question that linked to the previous topic, how do you approach situations where an adolescent is resistant to lifestyle or dietary changes?
Yes, that is actually very challenging.
Mm-hmm.
I think if you have lab tests, showing them data and showing them lab tests is very helpful.
Mm-hmm.
So they're more likely to sometimes take supplements. I usually have to prioritize because it only takes so many. So I
Yeah.
usually have to list these are the top, and then often I'll have the parents bargain with them. Okay, you're
Mm-hmm.
going to do this for a month or bribe or bargain.
Mm-hmm.
And then at the end of the month, plan an outing or plan some kind of, I don't say reward, but say, okay, I want you to do this. These are the top ones. This is why. This is what your lab test shows. And then let's do it for a month. Just try it for a month, see how you do. And then, you can do this or you do that. But usually I work better than the parents. Like the parents say, oh, do this, or like, no. But sometimes as a doctor, you're like, okay, I want to do this. I want you to see if you can do it for a month. Let me see how you can do it for a month. So it's negotiation.
Oh, yeah, fascinating. And it varies so much, doesn't it? Um,
Hmm.
I'll just go sort of to the bottom of the questions now because a lot have come in and then I'll work backwards. Veganism um, will be illegal in pregnancy, breastfeeding, and for children's diets in time. The data is flooding in now. Some parents in Holland and Italy, at least, have been jailed for child abuse for feeding their kids vegan diets, especially babies who've died
Hmm.
due to such poor quality breast milk. Would you agree with that, or is that not quite the status in the US at the moment?
I've never heard about any kind of legal findings. I
Mm-hmm.
have found I had a young child come in with full kwashiorkor, the big belly, the big liver,
Mm-hmm.
which you don't see in the United States from a rice milk vegan formula.
Oh,
So it's not illegal, but I think but it's really is. I agree with that. I think it can be very
kind of
dangerous.
problematic, yes.
Yes.
And another question here, how do we use the Nutramedix tablets with activated charcoal, coriander, and chlorella, etc.? Is it on an empty stomach or with meals?
Yeah, so there is something called cilantro, which is chlorella and cilantro, which I think of more as kind of a detox. And
Mm-hmm.
then there's a binder. And the binder you do want to use in between meals. The binders like the charcoal and the zeolite, the humic acid, the fulvic acids, and that between meals. The cilantro, not necessarily as much, um, if that makes sense. I think of it kind of like a detox, kind of drainage and binding. But the binder plus definitely in between meals.
Thank you. Yeah. Um, any comments? Susanna asks for an 11-year-old with delayed emotional regulation, recently diagnosed, and consequently, regular school is overwhelming and she doesn't attend.
Right. I mean, I would go exactly where start with nutrition, go through the whole all of that, if that makes sense. Emotional dysregulation, I've seen zinc deficiency, I've seen omega-3 fats, I've seen both of those, zinc and omega-3 fats, make a big difference.
Mm-hmm.
But that's where I'd start nutrition in the gut and then kind of go from there.
Okay. Thank
Especially
you.
then also look at developmental delays, things like that too, which can be common.
Mm-hmm. Another therapist writes here that she's seen that it's often extremely helpful to remove gluten from the diet because it's so neurotoxic. I think you did cover that, but is that something you always do, or do you use tests
I
to find
don't
out?
always do. I don't always do that.
Mm-hmm.
I know there are definitely practitioners who are very strict about it. If there's any kind of autoimmune issues, I think gluten-free you definitely need gluten-free. I do
Mm-hmm.
do some testing for it. Sometimes it's family history. Do they have any kind of GI symptoms? I'm much more likely to do that. More
Mm-hmm.
inflammatory immune
Right.
symptoms, if that makes sense.
Yeah. And if magnesium malate is unavailable, um, what other ones would you suggest and the strength of them? Are
Yeah.
other
So
forms full, or do you really always recommend going for that one?
yeah. If you have with constipation, magnesium citrate is a very good form. So if I
Okay.
have somebody with constipation, I might do that. As an option to malate, there's magnesium glycinate.
Hmm.
Those would probably be the other two forms that I would use.
The doctor asks whether one could also use pickles to ease, written here. I think that's a spelling error. The
Oh,
picolinate,
picolinate?
and
Yeah,
again, what
picolinate.
strength you would suggest, or whether you'd test to find out the strength first, looking at deficiency or the red cell magnesium.
Yeah, I think it's also kind of gut health, needing help, like what kind of symptoms they have.
Mm-hmm.
Sometimes it's bowel tolerance. I usually give magnesium at night because it's calming and it helps with sleep.
Mm-hmm.
I don't think the different forms there's any difference in terms of doses.
Mm-hmm.
Magnesium citrate, if they don't have a problem with constipation, you do dose it higher, you will get looser stools. So in
Mm-hmm.
terms of side effects, but I usually
Right,
kind of use it, and sometimes I use the combination too, depending.
right, absolutely.
Yeah.
And another therapist here asks which of the medications, well, what she means is the Nutrimedics remedies are particularly recommended for MS, if any. I know that takes us slightly off topic, but
Yeah.
children with
Yes.
children with mental issues can also have neurological
Yes.
conditions too. I don't know whether you want to answer that now or maybe next week or
Yeah.
another
With
time.
that MS, autoimmune, I would think about more immune modulation. So I
Okay.
would think of things like Cemento, or Basal skullcap,
Mm-hmm.
things like that. That's where I would kind of start, and then looking at gut issues. But if you're neurologic immune modulation, an
Yes.
anti-inflammatory, kind of like Avea, turmeric.
Oh, right. Yes, thank you. And she also asks, which genetic tests do you use? Do you have any specifically that you recommend in these kinds of age groups?
It depends how extensive. There are some that are very extensive. I think you actually you have Sharon Hausman Cohen's Intellex DNA.
Intellex DNA. Yes, we will be
Intellex
introducing
DNA.
those. They're excellent, aren't they? And they have a
Yeah,
fantastic autism panel, don't they?
yeah, but they have a mental health panel.
Yep.
So they actually have a panel that's targeted for mental health,
Mm-hmm.
and you can do the mental health panel and a neurodevelopmental panel.
Mm-hmm.
And that to me, as I said, it is if you want the most complete information. Sometimes I use something called Genomind if I have so many medicines.
Mm-hmm.
That gives it really a brief one, but also says they tolerate this medicine, they don't, how fast they metabolize. So it kind of varies, right, in terms of
Do,
what information you want.
do you find that one helpful or any of them for developing a strategy for weaning patients off psychiatric drugs, which is one of the hardest things we as complementary therapists find to do in the UK. And psychiatrists, of course, we need to work with, but it's a difficult thing, isn't it?
It's Genomind tells you what ones that you do better on. I don't know if it really helps you decide which one, how to wean off.
Mm-hmm.
Um, but that is, I think, extremely difficult. I agree in terms of weaning people off.
It needs to
Um,
be in the hands of a psychiatrist, really, doesn't it? Or in the sort of multidisciplinary team. Um,
yeah,
yeah.
especially if they've been on multiple medicines, especially the longer you on, the
Mm-hmm.
harder it is to get off them. So I think you really do have to be very careful.
Mm-hmm. And another question here from the Q&A is whether you'll be discussing support for sleep in a PANS PANDAS patient next week, or do you want to touch on that today? Just give us a few tips.
The chamomile and the valerian combination and magnesium works really well. We do have a melatonin. Some people like melatonin. Some people have bad dreams with it. Some people worry about it long term. Valerian helps you fall asleep, and the kind of
Mm-hmm.
the combination, magnesium, valerian, and the chamomile, which is the amatia and babuna, can be great. Can be really helpful for sleep
Oh, those
because
are
you have to take that
fantastic.
anxiety down too.
Brilliant tips. Thank you very, very much. Yes. Well, maybe you could go over those again next week, which I'm sure you will do. And then we
Yeah,
can
oh,
make
absolutely.
make
Yep, I
sure
can
that
do
we
that.
have a slide where those are all sort of documented, because that sounds like it's worth its weight in gold.
Mhm.
I've just switched back to the chat, and there's a super tip there about a new book by Dr. Horowitz, published by Maudsley Press, on how to taper off psychiatric drugs, including
Hmm.
SSRIs. She writes that it's a great book, and he's on lots of podcasts and videos about it as well. So
Hmm.
Definitely worth getting. I'll look at that as well. Thank you.
Yes, thank you.
Uh, Christina asks, regarding supplements, is there a minimal list or a minimum list, as often teenagers glaze over when you mention
Mhm.
one or two supplements?
Um, so if I can get, there are some multivitamins that have higher doses of Bs and have minerals.
Hmm.
So if I have to narrow it down, like at the active Bs and omega-3s are really key. And
Hmm.
then something that's going to help stress, right? Some adaptogen kind of calming herbs, if you really had to really break it down.
Hmm.
So, and sometimes I do. Usually if I can get 3 to 5, if I can get 5 in, that's usually um, kind of a way to do it. But omega-3s are huge, and getting the whole, make sure you're getting all the B's in and getting some magnesium, calcium, zinc. You can find some multis that have like 25 milligrams of zinc and have a good amount. Um, Sometimes a
Thank you.
powder, yeah, and mitochondrial formulas. There's mitochondrial support in some of these too.
Yes, and that's often really, really valuable, isn't it, to have a nice synergistic mix, especially for the
Absolutely.
mitochondria. Yeah. You mentioned lithium, and unfortunately, lithium is not really permitted in the UK for complementary
Oh,
therapists to prescribe. Isn't that strange? Just like
that is strange.
is also off the books for us. So there is some strangeness here in the UK.
Hmm.
We are. Um, there is a correction here that it's Mark Horowitz, not the
Oh,
Dr.
not Richard
Richard
Horowitz.
Horowitz, who we might have thought it was, and the name there, the Maudsley Deprescribing Manual. So we'll maybe
Hmm.
send that out with the notes as well, because that sounds extremely useful. Thank you. Um, Alison asks, can you tell us again the name of the genetic panels and who does them? Maybe I'll just type in here the name of the ones that we'll hopefully be introducing very soon. We're just in the process of sort of getting everything ready for that. Intellex DNA is
Okay.
the name of those panels that Dr. Debby mentioned just earlier. And then the other one that you talked about was Genomind, wasn't it?
Genome, and I don't know if that's available. So
Yes,
Intellex DNA is good because depending on the gene, she also gives information even about the supplement that's to support that. So
absolutely.
that is because otherwise you get this information and you're like, what do I do with it? It's really helpful to have even like especially natural treatments of, hey, this will target this.
Yeah, no, definitely. That is something that we find absolutely fantastic with those tests, and also, paring it down and prioritizing them.
Mhm.
Um, Maria Tsutsu just mentions that nutritional lithium is available to get from the natural dispensary, so that's really helpful. Thank you. Yeah, one just has, and lithium orotate, one just has to be very careful, I think, with the dosing and just make sure that the kind of team is aware of it. Often I ask the patients to do a test at TDL or wherever to just see their levels. And if they're zero, as they usually are, then that gives one a sort
Yeah.
of greater latitude to actually explain why one's prescribing it. So
Mhm.
I don't know. I'll just click over to the Q&A. I'm not saying we've covered all the questions. We haven't really, because there are still others. But what we can do very conveniently is keep some over for next week, because so many of
Mhm.
them obviously are tangentially related to PANS pandas. I mean,
Mhm.
do you, I know this is something that comes up when we talk about um, these basal ganglia conditions with molecular error. Do you actually feel that there are that there's a way of distinguishing whether a condition is purely sort of psychiatric slash psychological or more pathogenic slash infection triggered? Is there a way of detecting that, or is it all based on the testing once you've done it?
I mean, there are clinical symptoms, and there are some kind of clues. Sometimes, kids with PANS pandas will have developmental regression, like loss of handwriting, but they'll have other symptoms in addition to psychiatric ones.
Mm-hmm.
They'll have like increased urinary frequency or kind of some strange different things. I also usually try to look at like infection levels or antibody levels. So
Yeah.
kind of looking for the infections or looking for the Borrelia Bartonella,
Yeah.
so diagnosing what could be causing it, or looking at autoimmune markers, like a lot of them will
Absolutely.
be positive for ANA, things like
Hmm.
that. That can be
Hmm.
helpful.
Absolutely. Sometimes it is a puzzle, though, isn't it?
Yes, it
Yeah.
is.
Yeah.
I would definitely agree with
Yeah,
that.
yeah, yeah. And as we'll be discussing next week, or you will be with Rafi, it can be quite tough in the UK because we don't have any guidelines covering those conditions.
Mm.
And so they do tend to, the children or even adults do tend to be diagnosed with functional neurological disorder or whatever. And once they sort of
Mm.
have a label, it can be quite hard to sort of move them back into the um, physiological area
Mm.
of therapy on the
Yeah, these
National
kids
Health
can be
Service.
Yeah, these kids can be very, very sick. As I said, I've had children in the emergency room who are literally having hallucinations, and there's something called Alice in Wonderland syndrome. And I said we can all discuss this more next week, but these kids can be very, very sick, very, very
Absolutely.
severe.
Yeah, yeah. Well, thank you so much again. We have got to the top of the hour, and I'm mindful of your
Mhm.
time, but that was really, really tremendous information. We're extremely grateful, and there's lots and lots of very, very warm, enthusiastic thanks in the chat and the questions
Oh,
as well.
good. Well, thank you for, having me today, and I'm really glad to. This is definitely an area that means a lot to me, and I think is really
Thank you.
important. Yeah.
Perhaps before we send out the recording, ping us over the full titles of your books and where you would prefer people to buy them from, if you could.
Okay, I can do
That would be
that. Yes,
lovely.
I can do that.
Perhaps from your website. And then I'll just mention again that we'll have Dr. Hamilton back with us again next Tuesday, the 5th of August at 6 o'clock, where she'll be talking about PANS Panda's clinical strategies for immune and neuroinflammatory support. So we very, very much look forward to that. Thank you, everyone, for being here, and
Thank you.
see you next Tuesday. Bye bye. Thank you.
Bye-bye.